How to perform a breast self-exam and identify changes. Performing a breast self-exam is a simple way to get familiar with how your breasts normally look and feel. Being aware of your own body helps you notice any unusual changes early, which is important for breast health. While some health organizations no longer recommend doing a formal monthly self-exam for women at average risk, knowing how to check your breasts and recognizing changes can still be helpful, especially if you are at higher risk or not getting regular mammograms. Start by standing and dressed from the waist up in front of a mirror. Relax your arms at your sides and look at your breasts carefully. Check for any changes in shape, size, or contour. Look for skin changes like dimpling, puckering, redness, or swelling. Observe your nipples for inversion, discharge, or any unusual position. Then, place your hands on your hips and press firmly to flex your chest muscles and look again for any differences. Raise your arms overhead and repeat the visual check. This helps you see if there are any visible changes or new lumps. Next, lie down on your back with a pillow under your right shoulder and your right arm behind your head. Using the pads of your 3 middle fingers on your left hand, gently move in small circular motions across your right breast and armpit area. Use light pressure for tissue close to the skin, medium for deeper tissue, and firm for the tissue near your chest and ribs. Feel for any lumps, thickening, or hardened knots. Gently squeeze your nipple to check for any discharge. Repeat this process on the other side. This lying down method helps you feel the entire breast area thoroughly. You can also do a self-exam in the shower, where wet skin makes it easier to feel abnormalities. Use the same finger pads and pressure variations to systematically feel your breasts and underarm areas on both sides. Be attentive to any new lumps, thickening, or texture changes. Remember, consistency is key, so try to perform these checks once a month. The best time is a few days after your menstrual period ends when your breasts are less tender and swollen. If you are postmenopausal, pick a specific day each month to do your exam. While performing a self-exam, watch for certain signs that might indicate a problem. Look for new lumps or masses that feel different from the surrounding tissue. Notice any thickening or hardening in your breast or underarm. Changes in size, shape, or symmetry of your breasts are important to observe. Skin changes like dimpling, puckering, redness, or scaling should be noted. Also, pay attention to nipple changes such as inversion, tenderness, or any unusual discharge. Persistent pain or discomfort localized in one area should also be checked by a healthcare professional. Remember, self-exams are about becoming familiar with your body. They are not a replacement for regular clinical exams or mammograms, which are recommended by health authorities. If you notice any unusual changes or new lumps, contact your healthcare provider promptly for further evaluation. They can perform more detailed exams and recommend appropriate screening tests if needed. Current guidelines from organizations like the American Cancer Society emphasize that breast self-exams are optional for women at average risk but encourage awareness of breast health. Women with higher risk factors, such as family history or genetic predisposition, should discuss personalized screening plans with their healthcare provider. The main goal is early detection, which can improve treatment outcomes. Being proactive and attentive to your body helps you stay informed and ensures that any concerns are addressed early, supporting your overall breast health.